Hey folks, it's me again with another video. Last time we talked about like healthcare precautions and OSHA regulations, and today I wanted to review with you guys all about the, like from the employment rules and the financial standpoint of how this virus epidemic is affecting the practice and you. And I know there's been a lot of information out there, so I've tried to sift through it and vet things out and put it in a nice summary so that everyone knows everything that we know and so that we're all on the same page as far as where things are going from here. So with no further ado, I will start off on my next little slide presentation here. So again, the title of the presentation is Employment During the Coronavirus Epidemic. Just a little background, unemployment due to the COVID-19 pandemic. This is when I started this presentation, researching this presentation. This was a week ago. And 16 million people in 3 weeks time were unemployed. For just to compare that to back in the 2008 recession, less than 8 million people were unemployed, and it took 2 years to get to that point. So in 3 weeks, they've more than doubled what previously took 2 years. And this was last week's prediction. Several economists expected more than 20 million people will be out of work with the unemployment rate to 15%. So fast forward to today, and there's been another 5 million Americans this past week. They're saying that the total now is 22 million in unemployment claims over the past 4 weeks. And economists are expecting even more. So I'm certain next week it'll be more. So we've had 1.4 million people within 1 week alone claim unemployment, and back in 1982 the record was 695,000. So we're shattering those records in a bad way. And this is just a little bit of a pie chart going here. So whereas last week they were anticipating maybe up to 20 million, well, this just came out today. We're now at 22 million. So as we all know, Congress and the president have passed some laws and acts in the past several weeks. The first thing I want to talk about is the Families First Coronavirus Response Act. President Trump signed that on March 18th. It goes into effect as of April 1st, and it remains in effect until December 31st. And what that does is it says that if someone gets sick with the coronavirus, then they have up to 80 hours of paid sick leave if they're out due to the coronavirus. Now, if someone in their family gets sick, they get up to 80 hours of paid sick leave at 2/3 of the rate of pay. And in addition, they get up to 10 additional weeks of paid extended family medical leave at 2/3 the employee rate of pay. And that's if it's due to childcare issues as well. So reasons that people could qualify for the Families First Coronavirus Response Act: if they're subject to government, like if the government makes you go on quarantine because you've been exposed, if your doctor or nurse practitioner or physician assistant has suggested that you need to self-quarantine, if you're experiencing coronavirus symptoms and you're in the process of seeking a medical diagnosis, or if you're caring for someone who has been subject to government mandated quarantine or their health care provider advised quarantine. So far, thank God, none of us have come down with the coronavirus and had to be quarantined. And as far as I know, none of us has any family members with coronavirus that they have to take care of. So this, I just want to let you know, this is available should the need arise. But knock on wood, hopefully none of us need this. Next, I'm going to go on about the CARES Act. Okay. Now, this CARES Act, when you hear that in the news, it actually means a lot of things. and I was getting confused about this. So after further research, what that does is they broke it down into there's 3 areas that are pertinent to us that under the CARES Act. And the CARES Act stands for Coronavirus Aid, Relief, and Economic Security Act. Sorry about that. And that includes recovery rebates, Paycheck Protection Program, and expanded unemployment insurance. And this is what they call that unemployment program on steroids. So first, the recovery rebates, that's a $1,200 refundable tax credit, or for some people, they get a $1,200 check in the mail, and that gets doubled if you're joint taxpayers filing in one household. And also, they're adding $500 for each child. However, that's for every American family who earn up to $75,000 a year. If you earn more than $75,000 a year, then I think they decrease it for every couple $1,000s you are over that. So that was the recovery rebate program. Now I'm going to talk about the meat of the presentation is the Payroll Protection Program, or PPP. And what that is, that's currently what we are operating on now. And the ground rules for this is an employer must have fewer than 500 employees. So that's us. Now, for example, Wheeling Hospital, they don't qualify for this, but we do. The loan is for 2.5 times the payroll cost over a specified time frame, 8 weeks. So basically what they're doing is we calculate 2.5 times the monthly payroll, and that is what our loan is good for. But it's only allowed to be distributed over 8 weeks. 75% of that loan money is to be used for payroll, health insurance, and other benefits. The remaining 25%, what's left over, we have to use for mortgage interest payments, rent and lease payments, and utilities. Right now, we are in this unusual situation because we're paying rent and utilities, yet we also have a mortgage based on the new building that we're at. So, after that, there's literally zero left over. And actually, we're probably going to be in deficit on some of that. Now, the Payroll Protection Program, what's considered payroll eligibility? Well, that includes salaries and wages, cash tips for people who are like waiters or waitresses. Also included is paid vacation, parental, family, medical, or sick leave. Healthcare benefits is covered under there, as I discussed, retirement benefits, and payroll taxes. What's not qualified under the Payroll Protection Program, if someone has qualified sick leave because they're out with the coronavirus, then their salary does not count under the PPP because they're already covered by that Family First Coronavirus Response Act that I discussed earlier. If someone lives outside the United States, that's not included. And if an employee earns over $100,000 a year, that's anything above that is not included. So we talked about the payroll protection plan. Now, the other option out there is the unemployment, and there are some new additions to the unemployment under the CARES Act. These are conditions that were not present up until this was passed a couple of weeks ago. But what that is whatever your state unemployment rate is, you get workers will get an additional $600 added on to that. So if someone collects $300 a week for unemployment, they'll now get $900 a week. This program ends July 31st. And one other caveat is those who have already been on unemployment can now get an extra 13 weeks of unemployment benefits. That doesn't apply to any of us because none of our employees have been on unemployment. This just says about the $600 a week, the additional 13 weeks, and this is about self-contractors. Now, the next part about the unemployment, there's something, this concerns caveats about part-time unemployment, or also called short-time compensation expansion. Some states already have it, some states don't. But what this does is it allows employees who work part-time can still generate an income rather than be laid off total. So if an employer says, I can only have you work 20 hours instead of 40 hours, that the other 20 hours will be covered under unemployment benefits. Um, so that's actually good to know. Now, who is eligible for unemployment under these new rules? Well, you're ineligible if you're already under other unemployment benefits. If the worker is unemployed, they're eligible. And if they're partially employed, you're eligible. Or if they're sick due to the coronavirus related reasons. However, this would also be covered under the Coronavirus Family First Act, as described earlier, if you have a sick family member or you are sick. Now, who else is eligible? If the worker cannot work remotely from home, or if they are not eligible for paid leave. Other people who are eligible, if the worker is self-employed or a gig economy worker or an independent contractor. And if someone was set to start a job with a new firm, but due to the coronavirus, they haven't started their new job yet. Also, if the worker is the breadwinner in the household as a result of the death of the previous head of household. So if a husband passed away and he was the breadwinner, now the wife can qualify for unemployment. And also if the worker's company has just totally closed up as a result of the coronavirus crisis. So who is not eligible for unemployment? Employees whose company is up and running. And so if your business is up and running and your employer has work available for you, then you're not eligible for unemployment. Employees who are already receiving benefits from their employer under the unemployment policy already, then they're not eligible for additional benefits. And Americans who are new to the workforce, like you just graduated from high school and you're looking for a job but you can't find one, you're not eligible for unemployment because you were never employed to begin with. Now, from the employer standpoint, regarding this CARES Act, as I said before, we have to pay 75% of the money goes to the payroll, that's the employees and their benefits. 25% goes towards the rent, utilities, mortgage interest payments, etc. So, but in order to qualify for this, you have to have no more than 25% of your employees can be laid off. Because what this does is they want employers to keep their employees on the payroll. So, for example, if we have 16 employees and 7 employees had to be laid off, which would be terrible. But if that were to be the case, then we would no longer qualify for the SBA loan. So not only we're fortunate that we have the loan, but we have to stay compliant with it, or else all of that money has to come back out of our pockets. And one other thing that I thought this was important to say is that as of this morning, that SBA loan program where we get the payroll protection plan, that has now run out. And I've talked to some other doctors this morning who did not have their loan numbers yet, and they're now waiting out in the wind, and they're not certain if they're going to be able to get this loan or not because they ran out of money. So one thing that I think we all should be grateful for is that Dana and Missy, the day that this was passed on a Friday, on Saturday morning, they had the bank president and our accountant and them on the phone so that we were literally first in line so that we could qualify for this. So I think we all should be grateful for that. One last thing is that, so as I said, we're fortunate to continue paying our payroll. as I believe no one has missed any money or any paychecks to date because of this. This does last 8 weeks. After 8 weeks, what happens then? I don't know. We don't know if they'll have more of a government stimulus or if that will be the point where people are just going to have to start paying out of their reserves, or if more layoffs are going to have to happen. I don't know. Hopefully, this will not be a point for any of us because at the end of 8 weeks, hopefully the office will be up and running, and we'll have a backlog of surgery and patients to see. But I do think in the meantime, any patients that we can see now is very important because that's going to help us build our reserves in case things run out after 8 weeks. And we're already a few weeks into that. So I think it's going to be really important that we all have to work so that we can, keep the visits coming in, whether they're video visits or parking lot visits or things where it's safe to bring them into the office. But I think we're going to have to do that. Um, and whether that means that we have to work in shifts where some people come on the weekends or after hours or something like that. We're not going to ask anyone to work more than 40 hours, but I do think it's important that at this point we're probably going to start bringing people back in. And again, the environment will still be safe, but we're going to have to start working the phones and teeing up video visits and doing what we can to keep things open. Okay. So with that said, here's my ugly mug again. Thanks a lot. I hope y'all are staying safe. And as next week, as we start to roll things out again, to start to try and gradually ramp up again, since we're through the surge, I look forward to seeing people back. Thank you. Oh, and if you guys have any questions, you can call us or call Missy or Dana or Jeremy or myself. Thank you.